I've begun work in France in recent years, largely because of their coming up to the top of the rankings on health and health care. And it fascinated me as to why France would be considered the healthiest nation in the world. This was a WHO rankings that came out several years ago. And as I began to examine and investigate, I found that there was an interesting combination of both political direction as well as structural strength that was allowing the French to do things that the United States really wanted to do. So I began to work with some folks in the development of some projects looking at rural health in France and access to rural health care. And from that, got a chance to meet with some folks who were just beginning to develop a new comprehensive school of public health in France. France didn't have a comprehensive school of public health, and that's one of the things that they felt was a hindrance to their really getting ahead in, say, the scientific world. So I had a chance to meet with the founders of that school, and they invited me to take a role in developing the curriculum and developing the planning for that school. And so I've taken on that role and now the coordinator for health policy and management, and I'll be teaching there in the fall. And with the help of a Gillings visiting professorship, I'll be able to develop links to UNC Chapel Hill and the Gillings School of Global Public Health over the next 2 years. So I look at this as a great opportunity for us to learn from France, which has great strengths, but they're also seeking understanding of how we do things more efficiently and how we do things in some ways that are better than what they do. So I see this as an interesting and fruitful marriage of two, what I hope will be great institutions as the French school tries to match the UNC school's reputation.